products that can be used by public administration or hospital or whoever for taking decisions. We have 3 different presentations. The first one was how the sector of data mining and data gathering in health is working and evolving. They are more collaborative now, even affected by COVID-19. They have decided to collaborate more and to offer more data, free data. Then we move to different experiences on how to do data mining and big data to take informed decisions. And the last presentation was about the region of Extremadura and how they have been using artificial intelligence and robotics to work with elderly people in distance areas. The 3 at the end, in the final round of question and debate, we try to link all the presentation with the pandemic situation that we are having now. And I make question, all of them related to COVID-19. And that was like the link between the 3 presentations, and the speakers were outstanding and really very good content for the session. And I think this is the debriefing.
What are the conclusions, Jose? If you want to capture what you've major learning from that session, what did strike you?
The most important learning to me was that the situation that we are living with COVID-19 is changing the whole market, and people is analyzing data and collaborating more and more. But at the same time, we are still using Excel files. I mean, the technology is there, but really not everybody is using the technology to the maximum possibilities. This was a little bit that there are more collaborative approach, but really there is a misuse or a low level of usage regarding the technological development that we have now in Europe.
Fantastic. Thank you so much, Jose. Gerard,
can I add this really important point? Guys?
Yeah, take away.
No, I was going to actually take away from his very important point that people are still not, there's a benign way of adopting technology, but the willingness to accept that technology and change, it's the really, really hard thing, right? And I go back to, I've done a lot of different talks about why digital transformation projects fail. And if you look at statistics from Gartner, McKinsey, Boston Consulting Group, all the big analysts, they state that 2/3 of the digital transformation projects fail and have been failing. COVID has been a super huge catalyst to accelerate that transformation. But the reason they fail is because of us, people, right? Because we are not that easy to change. We're complicated human beings, right? We make, as they say here in Sweden, you make a chicken out of a feather or mountains out of molehills when it comes to change, and we make things complicated. Look, you get in arguments with your wife, with your kids, with your girlfriends, your boyfriends, with people in the street over silly things. And when it comes to changing in our jobs, when we're comfortable in adopting technology and making that actual change that the technology brings, it's actually really, really hard at times. And I'll give you an example. Here in Sweden, it's a highly developed nation with a lot of technology that's being born here. And in the hospitals, we're still using across the country 97,000 fax machines. And you wonder, why on earth do you use fax machines to communicate? Well, no, the systems don't talk to each other between hospital to hospital. Why? Well, I don't want to. I want to protect my area. I don't want to communicate with these guys. And this is insane. You see what I mean? And it hasn't changed.
There are cultural barriers there.
Exactly.
It's so important, Gerard, that you raise these points of the cultural barriers, because we need to address them later on the afternoon. We have more sessions, and you are going to do a keynote, and we are very expectations on that. Dr. Satish Rath, it was a pleasure to have you here. What were the main takeaways from your breakout?
I think, what Gerard was saying. So, we also felt the need of, not having an easy way of sharing data. So protecting privacy, but I think, when it becomes multiple stakeholders from providers to pharma to medical device to AI software companies, there are regional boundaries and there are regulatory boundaries. And the most important is what Gerard was saying is there are cultural boundaries. So even if you are sitting on data, you are not aware that you can use this data for invention. And the people who want to have the data, they also don't know where to go to get this. So I would say these were the main three ones. We have interoperability technologies. We do have, let's say, accountability or transparency kind of blockchain kind of technologies. But I think putting people, technology, and the need together, where you have the data producers, you have the data regulators, and you have the data users, I think that somewhere is still, I think, at the back end. So it's still not reaching the front end. So that was the crux of things, what we were, thinking about.
Thank you so much, dear guest speakers, for sharing your time in this Global Hybrid Summit. So let's have a pause now for a break, lunch break, in our case, maybe dinner break in India. And let's be back at 2 o'clock UTC. Thank you so much.
So
and
3 p.m.
See you later.
Okay, speak later. Thank you.
Speak later. Thank you. Thank you so much.
Bye-bye.
Thank you for joining us. Thank you.